talk about another category of drugs that might be used to ease pain. And because our next chapter, our last chapter, chapter 12, is going to deal with musculoskeletal issues, I am not entirely sure why they switched and put skeletal muscle relaxants with the pain relievers rather than the musculoskeletal drugs, but whatever, it's here. And so on page 221 at the bottom, you see muscle relaxants discussed. And usually everybody by adulthood has at least achieved a slight familiarity with muscle relaxants. They're given to reduce muscle tone and to stop involuntary movement, but they do allow you to move voluntarily. They're going to act either centrally on the brain or by affecting the cells of the muscle themselves, depending on the type of drug. So they're used for relief of pain if you injure yourself. You know, you have a muscle strain or a car hits you from behind and you have whiplash. But it can be used for long-term neurologic disorders. So a person who is paralyzed usually ends up with what we call the worst of both worlds, because they lose their ability to move voluntarily, but they will still have involuntary muscle movements and even spasms, like leg cramps. So imagine being able to feel leg cramps, but not being able to hop out of bed and walk around until they're gone. And so you can see why somebody with paraplegia or quadriplegia would need muscle relaxants to be taken often. On page 221 at the bottom, we see medications that are intended for short-term relief. So probably the most common is cyclobenzaprine or Flexeril. And then Robaxin is another one. And these are a lot of times given after injury. You are playing a sport and you get a groin pull, or somebody runs into you and you're just sore all over and everything spasms up. Other muscle relaxants are meant to be used over a longer period for chronic illnesses that involve spasticity, such as paralysis. So baclofen would be an example of that. Many times baclofen is given in a pump that's implanted under the skin to give a constant dosage. Adverse reactions are usually dizziness, drowsiness. You don't want to take a muscle relaxant and then drive over to school. You know, you're going to be sleepy and your reaction time is not going to be as good as it ordinarily would be. Skeletal muscle relaxants do not interact well with any kind of central nervous system depressant. So here we've got the list. It runs the gamut. Narcotics, sedatives, anti-anxiety agents like benzodiazepines, anything that's going to put you to sleep, alcohol, general anesthetics, and then our old friends, the MAOIs and the tricyclics for depression. Cyclobenzaprine and orphanidine, which we talked about before, Flexeril and Robaxin, they have anticholinergic effects. And so if you're taking them with alpha blockers, sometimes they will interfere with antihypertensive activity. Anticholinergics are going to raise the blood pressure. Alpha blockers are going to try to lower the blood pressure, and those drugs are just going to butt heads. So you want to ask for advice if you're taking any kind of a blood pressure medication and somebody gives you a skeletal muscle relaxant. Usually the muscle relaxants are given temporarily until the muscle heals itself, and then the pain is going to go away. I apologize for my dogs barking in the background. The mail has come and they want the whole world to know. Make sure you read patient and family teaching for the muscle relaxants. You want to talk about how to administer these meds. You want to avoid any activities that require you to be alert, because you won't. Look for drug interactions, like I said, central nervous system suppressants. Don't miss a dose, although many times they're PRNs, so there's no worry about missing dosages. You should educate the patient on when to contact the healthcare provider, We recommend taking these meds at night when you're going to be sleeping anyway, and then the usual storage and safety advice. The last particular type of pain relief we're going to be talking about, we have talked about before when we talked about migraines. We talked about the tricyclic antidepressants such as amitriptyline, often given for chronic pain issues in smaller doses and even migraines. Certain SSRIs can be really helpful if you've got certain kinds of chronic pain. They give the examples paroxetine and sertraline, or Paxil and not Prozac, Zoloft. But other drugs work pretty well. For instance, Cymbalta can be very effective against neuropathy and the pain and burning of neuropathy. All of these medications can help increase the amount of natural opioids in the brain. By increasing the amount of norepinephrine and serotonin, they almost give you a sort of natural opioid. Just the way not having enough of these can cause depression and can also add to chronic pain. Depression and chronic pain sometimes can go hand in hand. They aggravate each other. Also, the anticonvulsants gabapentin or Neurontin and pregabalin or Lyrica also relieve nerve pain and migraines. And you can see why in the names. Gabapentin, they increase the brain's response to GABA aminobutyric acid, and pregabalin. Both of these are going to increase the amount of GABA in the brain and cause a certain amount of relaxation and relief of chronic pain from nerve issues.